Are your joints stiff and swollen, especially in the morning? Don't ignore it. This could be an early warning sign of rheumatoid arthritis. The key to preventing long-term joint damage, it's in catching early RA and starting treatment as soon as possible. Let's talk about what to look for and what to do next. Hello, I'm Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, and metabolic health. My goal is to help you stay pain-free and in control of your health. Rheumatoid arthritis, or RA, is an autoimmune disease that attacks your joints, causing inflammation, swelling, and long-term damage. The sooner we recognize RA and start treatment, the better the outcomes. In this video, we'll go over the following: the earliest signs of RA, why early diagnosis is tricky, the best ways to diagnose RA before it's too late, and why starting treatment early is critical. Let's dive in. RA is not the same as regular arthritis or osteoarthritis. It's an autoimmune condition, meaning your immune system mistakenly attacks your joints, leading to chronic inflammation. If untreated, RA can cause permanent joint damage, loss of mobility and function, increased risk of heart disease and other complications as well. But if caught early, we can prevent long-term damage and preserve joint function. Early signs of rheumatoid arthritis include the following. Number one is morning stiffness that lasts for over an hour. Unlike regular stiffness that lasts a few minutes, RA stiffness can last over an hour and even most of the morning or the entire day. Prominent swelling and pain in the small joints, including the hands, wrists, and feet. RA usually starts in the fingers, wrists, and feet before affecting larger joints. If your rings are starting to feel tighter or your knuckles look swollen, this could be an early sign of developing RA. Number three is symmetrical joint pain. RA classically affects both sides of the body. For example, both wrists or both knees. Next is fatigue and weakness. Many people will feel tired all the time because of the chronic inflammation, even if they have slept well. RA is an inflammatory disease, and that inflammation drains your energy. Next, on occasion, unexplained low-grade fevers. A mild fever without an infection, this could be your immune system overreacting due to RA. And then joint pain that starts by occurring episodically. Early on, RA symptoms might flare up for a few days and disappear, making it easy to dismiss. Over time, these flares become more frequent and severe. So why is early diagnosis of RA tricky? One of the biggest challenges with RA is that early symptoms can be subtle and hard to diagnose. Here's why. First off, blood tests, like antibody testing, are often negative early on. Many people assume a negative test means no rheumatoid arthritis, but that's not true. In fact, up to 50% of people with RA will actually be antibody negative at initial diagnosis. X-rays also are usually not helpful in early RA. X-rays can show joint and bone damage, but that typically does not show up until later stages of RA. RA symptoms can also mimic other conditions, leading to misdiagnosis or delays in treatment. That's why seeing a rheumatologist early is crucial. So how is early rheumatoid arthritis diagnosed? RA cannot be diagnosed with just one test, meaning we look at the full picture. To begin with, a proper and full medical history and physical examination. We ask about joint pain, stiffness, swelling, and fatigue. We check on examination for joint tenderness, swelling, and motion limitations. Then we'll check blood tests. Your rheumatoid factor and anti-CCP antibodies are important and very strongly connected with rheumatoid arthritis, but they can be negative early on in up to 50% of patients. So it's not a be-all, end-all test. Another lab test that we'll check are your inflammatory markers, your CRP and sedimentation rate. They can help detect inflammation in some people. Next, there's advanced imaging, including ultrasound and MRI. Musculoskeletal ultrasound can detect early joint inflammation and erosions, even before symptoms get severe. MRI is another tool that on occasion will check that can reveal early rheumatoid arthritis changes and inflammation before x-rays show damage. My personal preference is utilizing musculoskeletal ultrasound because that can be done during your appointment so we can see in real time what's actually happening in your joints. The key takeaway here is if you have joint symptoms, don't rely only on blood tests. A clinical diagnosis based on your history, exam, and imaging is absolutely key. Advanced imaging is important, such as MRI and ultrasound, because if you have signs of active inflammation in the joints, not only does that secure a diagnosis for you, but it's also predictive of more aggressive disease if you do not treat it. Meaning if you have signs of significant inflammation on ultrasound or MRI, that puts you at higher risk of developing erosive, damaging disease within the next 1 year, which is why treatment early on becomes important. There's a critical window of opportunity in rheumatoid arthritis, meaning the first 6 to 12 months after symptoms start, where if treatment begins appropriately and early enough, we can reduce inflammation and pain, prevent irreversible joint damage, and lower the risk of disability. But if treatment is delayed, RA can progress aggressively, leading to permanent damage. Rheumatoid arthritis won't go away on its own, but early action can stop it in its tracks and put it into remission. Here's what to remember. Do not ignore early symptoms like joint pain, stiffness, and swelling. Blood tests are not always reliable early on. Your diagnosis should be based on a proper history, exam, and imaging. And the earlier you start treatment, the better your long-term outcomes. If you found this video helpful, hit the like button, subscribe to the channel, and share this with anyone who might benefit. If you're in the Chicago area and need expert care for your arthritis or joint pain, visit chicagoarthritis.com to schedule a consultation. Stay proactive about your health, and until we connect again, live well. Bye-bye.